afternoon, everyone. In today's class, we will be studying about the anatomy of face. How would you define face? Face is that part of the head and neck which extends from the hair margin to the chin and from one auricle to the other. As we discussed earlier, the forehead is shared both by the scalp as well as face. Now, why is the anatomy of the face very important? That's the first thing you would look at in a person when you meet a person. When the patient walks into your chamber, the look, the expression is going to tell you a lot of things. First of all, the pained expression, if the patient has, will tell you about the discomfort which the patient is facing. Then the color of the face, whether it is pale, will tell you about the general health, or the yellowish discoloration would tell you maybe the patient is suffering from jaundice. So just looking at the face and the skin of the face and all the other parts of the face, you will be able to come to a conclusion, at least come to some preliminary things within your mind as to what may be the problem with that patient. For example, look at this gentleman. This gentleman is a 33-year-old man who comes to you in the OPD, and when you look at him, the moment you see, you can reach a diagnosis by just looking at this patient. Now, I'll tell you the history which this patient will give. So he'll say that I have had high-grade fever for the past, say, 48 hours, 2 days. And today morning, when I got up, I saw that when I saw in the mirror, I saw that my face was distorted. While I was having breakfast, I found I had difficulty in chewing. I even had a tough time while trying to brush because I wasn't being able to gargle the water in my mouth. And when I smile, my smile seems to be crooked. There is also dribbling of saliva which is taking place from the right side. And on my right side eye also, there is some tearing which is taking place. The moment you see this patient, you will be able to come to a conclusion. So how? This is what we are going to be studying in this particular class. The competencies which we will cover are: describe and demonstrate muscles of facial expression and their nerve supply, describe the sensory innervation of face, identify the superficial muscles of face, their nerve supply and actions, describe and demonstrate branches of facial nerve with their distribution, and explain the anatomical basis of facial nerve palsy. This lecture I'll be taking in 2 parts, so these are the first set of competencies which I'll be covering in this particular lecture. The next set will be for the next lecture. Now let's start studying the face from outwards inwards. So on the outside or on the external part is the skin. The skin is like any other skin in the majority of the body, which is covering the majority of the body. That is, it is thin skin. But in terms of thickness, it varies. For example, the skin of the eyelids is thinner as compared to the skin which you have on your cheek. So there is a difference in its thickness. Histologically, it is thin skin. Now, it has a large number of sweat glands which are present. When you wear your mask these days, there is a lot of sweating which takes place internal to the mask. So that tells you that yes, the face has a large number of sweat glands. Also, when you exercise, your face sweats, right? So the face has a large number of sweat glands. It also has a large number of sebaceous glands. Your face becomes oily. It has pimples. Now, below the skin is the superficial fascia. Apart from the loose areolar tissue and the nerves and the vessels which superficial fascia usually contains, there is a distinct difference in the superficial fascia of the face, of the head and neck, and especially the face. It has muscles in it. These muscles are remnants of panniculosus carnosus. There was another place in the body where you've seen the superficial fascia containing muscles. Yes, in your palm, the muscle palmaris brevis was present. But that was just one muscle. The face has a large number of muscles which are present in this superficial fascia. On one end, these muscles may be attached to another part, maybe to the fascia or to the bone. And on the other end, they come and attach to the dermis of the skin. So by their action, they pull the skin. When they contract, they pull the skin, and this pulling results in various facial expressions. Number 1. Also, if there is an injury or an incision or a laceration on the face, it tends to gape because these muscles tend to pull the wounds from all directions, causing it to gape. Underneath the fascia, there is always superficial fascia, there is deep fascia. Now, deep fascia in the face is usually absent. Please remember, I'm talking about the face. In the face, the deep fascia is usually absent. However, it is present in certain places around the parotid gland and also in the cheek, where it is known as the buccopharyngeal fascia. At the other places, however, it is absent to allow for mobility of the face. Now, these muscles, which we just talked about, the muscles, the superficial, which are present in the superficial fascia, it's that what we are going to discuss in this part of the lecture. Now, these muscles are present around the three orifices which are present in the face. These are, or the three cavities, the orbital cavity, the nasal cavity, and the oral cavity. Now, these muscles are oriented around these three cavities. They are not there for us to be able to depict facial expression. They're actually there to guard the openings of these particular cavities. So the orbital cavity on the external surface, the most superficial surface structure which is seen on the orbital cavity are the eyelids. In between the eyelids is, as you can see, the eyeball in the palpable fissure. So the function of the muscles here is to regulate the traffic which is going through these eyelids. What is the traffic? The light. So they regulate when there is excessive light, you tend to close your eyelids, or to protect your eye from the dust. So they're actually, they have a protective function. They're going to be doing that. As a byproduct, as a collateral, we have facial expressions which are seen. I'll just discuss it in detail as we go forward. Then they are present around so these are muscles of the eyelids, which are present around the orbital cavity. Then we will be talking about the muscles of the nostrils, which are going to be present around the opening of the nasal cavity, and the muscles which are forming the lips. These are that is the superficial structure which is present around the oral cavity. So in this picture, you can see these multiple muscles. These muscles are the ones which are present in the superficial fascia. So as I told you, there are a large number of muscles which are present in the superficial fascia of the face. Now this muscle we've already seen. This is the muscle of the scalp, which is the frontal belly of the occipitofrontalis muscle. Right? We've already done this. Now we are going to be focusing on the muscles around the orbital cavity, which are forming the framework of the eyelids, which you can see out here. Then we are going to focus about the muscles around the nasal cavity, which are involved in the structure, which are also forming the structure of the nose, and the muscles which are forming the lips. Now, in between the eyelids, the upper eyelid and the lower eyelid, this space is known as the palpable fissure. And through the palpable fissure, you can see the anterior part of the eyeball. Now, the function of these muscles is to dilate or constrict this space. So, when you have this expression of horror, your eyes become wide. This palpable fissure becomes wide. And at the same time, when I'm glaring at you or I'm menacing when you've done something wrong or you've given a proxy, my palpable fissure would become very small and I would have this menacing look. So that is the expression which I can show by changing the size of the palpable fissure. But the main function of these muscles is that they are there to protect the eye. So the muscles, these muscles which are present around the orbital cavity will help us to blink. They will help us to wink. They will also help us to have an equitable distribution of the tear film, and to prevent the cornea from drying. That is what they are there for. And to do this, to control the amount of light which is entering into the eyeball. By shutting, when there is bright light, we shut our eyes. So that is what is the function of these muscles. Then and if this muscle becomes paralyzed, if some of these muscles become paralyzed, this is what is seen, the drooping of eyelid, which we were talking about in thorax. So how does it happen? We'll see out here. Then there are these muscles which are present around the nasal cavity, whose main function is to control this opening, either dilate the nares or constrict the nares. Now, that's not something which we use very often, but these days, due to COVID-19, a large number of times when you have COVID patients, or generally we are asked ki deep breathing karo, अच्छे से सांस लो, pranayam karo. In that time, we dilate our nostrils to allow larger amount of air to enter. So then we are using these muscles, which we'll be talking about, which are present around the nostrils. And then there are muscles which are present, which are forming the framework of the lips, and they are controlling this space which is present between the lips, which is the oral fissure. So we are only on the outskirts of the oral cavity. We are talking about the oral fissure, the space which is present between the lips, which is controlled by these muscles which are present around the oral cavity. And we would be talking about the orbicularis oris and these various muscles which are radiating out like the spokes of a wheel from it. Again, these muscles we just saw this gentleman whose mouth was getting distorted. So that tells you that's when these muscles get paralyzed, the mouth will get distorted. It will get pulled towards one side. And this is what we need to understand with this lecture. So these are muscles of facial expression, popularly called. However, these are actually muscles of the eyelid, the nostrils, the lips and cheeks, and they are controlling the space between them. They are either making the space big or they're making the space small. As a byproduct, as a collateral of this action, the facial expressions are shown. Now let's start with the muscles of the eyelid. The muscles of the eyelid are controlling the palpable fissure. They bring about changes in the palpable fissure, which was the space which was present between the two eyelids. There is a sphincteric muscle, which is known as Orbicularis Oculi, and there is a dilator muscle, which is known as levator palpebrae superioris. So let's start with the bony coverings of the orbit. I'm sure you've seen it. Let me just revise this with you. This is the orbital cavity. This here is the orbital cavity, and this is the outer orbital margin. This is the superior orbital margin. You can see the supraorbital notch which is present out here. This is the medial orbital margin. This is the nasal cavity. This would be the inferior orbital margin, and here is the lateral orbital margin. Now please focus on the medial wall of the orbit, right? This is towards the nasal cavity. So this here is the medial wall of the orbit. Now on the outside, the medial orbital margin is formed by a process of this bone, which is maxilla, which is known as the frontal process. And this edge of it is known as the anterior lacrimal crest. Thereafter, this suture out here demarcates this thin papyraceous bone, which is this thin bone which is present out here, which is the lacrimal bone. Right? And in this lacrimal bone, you can see again, there is this edge-like structure, which is the lacrimal crest, posterior lacrimal crest. So we have an anterior lacrimal crest. There is this posterior lacrimal crest. And here, this posterior lacrimal crest divides this lacrimal bone into a groove-like area in front, anteriorly, where is present the lacrimal sac and a posterior flattened area. Now here, this is the lateral margin, and this would be the lateral wall of the orbit. When you are there with us, you will be able to feel a projection in it, which is known as the Whitnell's tubercle, but this is not seen when you look at it. In this particular picture. So in this particular picture, you can see on this particular side, you can see the lateral wall, which is well defined. And this here is the tubercle, which I'm talking about, the Whitnell's tubercle, which is present close to the lateral margin. Now, let's draw the orbit. If I was to draw the orbit, please draw with me the superior orbital margin. Now, this is the lateral orbital margin, the inferior orbital margin, and out here would be the medial orbital margin. And somewhere here would be the nasal cavity. So what we've drawn is, we've drawn the right side, right? This is the superior aspect, and this out here would be the lateral aspect. Now here, we also saw a crest on the medial margin, which was the posterior lacrimal crest. Now, in the orbit, forming the framework which is separating the external aspect of the orbit from the internal, this orbital margin area, from what is present inside, there is a septum which is present, which is attached all around to these orbital margins. ठीक है? This is made up of connective tissue. This is known as the orbital septum. And within this orbital septum, two thickenings appear during development. One is an almond-shaped thickening, which is nothing but the thickening of this particular, septum. Almond-shaped thickening above, which forms the superior tarsal plate or the framework of the, upper eyelid, and a rod-shaped thickening below during development. This is smaller, and this forms the framework of the lower eyelid. I'll remove the rest of the stuff. You know that there is this orbital septum, and now this is the lower eyelid. The space between them, is the palpable fissure. On these two eyelids are connected to each other on the medial side and the lateral side. On the medial side, this connection forms a medial palpable ligament which goes and gets attached to the anterior lacrimal crest. And on this lateral side, it forms the lateral palpable ligament which goes and gets attached to the Whitnell's tubercle. Right? So this is the orbital orbit. And these are the two thickenings which we formed. The medial palpable ligament, which is attached to the anterior lacrimal crest, and this here is the lateral palpable ligament. So this is the framework of the eyelids, and on this framework, so usually हमने अभी तक क्या देखा है? The framework is made up of bones और bones के ऊपर muscles attached है. Here, this framework is made up of connective tissue, which is a part of which is thickening, which is the orbital septum, which is a dense connective tissue, which is present all around the orbital margin. I've removed it for clarity of my image. Now, on this, at two places in the area of the upper eyelid and the lower eyelid, it thickens to form these tarsal plates, which form the framework of the eyelid, and these are going to be covered by the muscles. So the muscles which we are going to be talking about is the Orbicularis Oculi, which is the muscle. First, we are going to talk about the Orbicularis Oculi, which is the constrictor muscle of the, which is the sphincteric or the constrictor muscle of the eyelid. Now, this muscle, again, as you know, I do not have a brown color, so I will either use an orange or I will use a dark. So I'll go with orange right now. Now, this muscle, the Orbicularis Oculi, this oculi is made up of three parts: the orbital part, the palpable part, and the lacrimal part. The orbital part of this muscle arises from the medial palpable ligament. From the medial palpable ligament. It arises from the surrounding bone of the, which is present on the medial side of the nose, of the forehead. It goes all around the orbit from the cheek and then goes back and gets attached to the medial palpable ligament. So it has no lateral attachment. It goes all around the orbit. It arises from the median palpable ligament and it gets inserted back into the medial palpable ligament. This is the orbital part of the muscle. Now, when this muscle contracts, so obviously these fibers will move towards the, like this. These fibers will move like this. So they are moving medially. So what are they going to do? When these muscles, when you do the screwing up of your eyes, when you want to protect it against very bright light of the skin, of the sun. So that function is brought about. The closure of the eyelid and that tight squeezing of the eyelid is brought about by the orbital part of the Orbicularis Oculi muscle. And in that process, when you do this, You can also make this also becomes once sometimes when you also have that when you're frowning or you're giving out the expression of disgust. So that of disgust or even that also comes in by the use of this muscle of the orbital part of the Orbicularis Oculi. The palpable part of the muscle, now just to be able to distinguish between the two parts, I'm drawing it in another color, arises from the medial palpable ligament and goes and gets attached to the lateral palpable ligament. This is the palpable part of the muscle and it's present in both the eyelids, and its function is to bring about the light closure of the eyes, which what you do when you want to go to sleep or when you are blinking. That action is brought about by the palpable part. The palpable part also becomes active when we also is active when we are when with the orbital part is acting, when we are bringing about the tight closure of the eyes. Now, another thing which the orbital part does is that it draws the lateral part of the eye medially. So ये सारा का सारा medially move कर रहा है. All this muscle fibers will move medially when the orbital part contracts. As a result of which, we tend to take all the tear film from the lateral side towards the medial side where the lacrimal sac is present. It is present in between the anterior lacrimal crest and the posterior lacrimal crest. We do that as we go further. So the movement of the tear film from the lateral aspect towards the medial aspect, because the lacrimal gland is present laterally, but the sac is present medially. So gland secrete kar raha hai yahan se. So here would be the lacrimal gland, which would be secreting the tears. The tears would go all over the eye, but you need to take them out. So jab secretion eye, so we want to take it medially. The secretion will move medially by the orbital part of the Orbicularis Oculi. It's not there for us to be able to show the expression of disgust or for frowning. It is actually there to help in the movement of this tear film so that वो lateral से medial जा सके. And the other thing it is there for to protect our eyes from very bright light or from dust. That's what we are using it for. But as I told you again, collateral is that we get an expression. So when we wink, we use this orbital part of the Orbicularis Oculi. Now let's go on to the next part of it, which is the lacrimal part. So this particular figure out here. So this shows us first, let's look at this is the disposition of the orbital part of the muscle. This is the distribution of the palpable part of the muscle, right? And this is the action. The palpable part, it brings about the light closing of the eye. The tight closing of the eye is a function of the orbital part. Now the lacrimal part. The lacrimal part attaches to the posterior lacrimal crest. And from here, it moves towards the eyelids. So its function is, यहाँ पर वो lacrimal sac पड़ा हुआ है, which I was talking about. So here would be the lacrimal gland, and here posterior to this muscle here, this would be the space which is occupied by the lacrimal sac. So it helps the lacrimal part, dilates the lacrimal sac and allows for the flow of the fluid, because this lacrimal part is not only attached to the posterior lacrimal crest and to the eyelids, but is also attached to the lacrimal sac. So it helps in the dilatation of the lacrimal sac which is there. The nerves which are supplying these muscles are the branches of the facial nerve. Again, like the scalp, here also the muscles are going to be supplied by the facial nerve. हम अभी इसको detail में करेंगे, but for the present, please remember the temporal branch and the zygomatic branch. So the action of the muscle is to close the eyelids completely. The forceful closure is mediated by the orbital portion, whereas the palpable portion is responsible for light closure as well as blinking. The lacrimal part dilates the lacrimal sac to ensure flow of fluid. So this is the facial expression which has come in, which is the byproduct. You can see the expression of disgust or, oh, I don't like it, kind of an expression which we can show by using this muscle. Now let's talk about the dilator component of the muscle of the muscles of the eyelid. So we've talked about the constrictor part. The constrictor part was formed by the Orbicularis Oculi, which was going all around, circularly all around the orbit. Now this obviously should be longitudinally placed. अगर उसको eyelid को elevate or depress करना है, so it should be longitudinally placed. So this muscle here is the levator palpebrae superioris, which arises from inside the orbit, from the roof of the orbital cavity, from inside the orbit, and then it moves along the orbital cavity and enters and gets inserted into the various components of the eyelid. So what are these components? Now we've taken a section, a sagittal section like this, to see the structure or the framework of the upper eyelid. So here would be the skin, and this is the frontal bone. So this is the frontal bone which we are talking about. So this here is the frontal bone. Now from around the orbital margin, all around the orbital margin is this orbital septum, and this septum has got thickened in the area of the upper eyelid to form the tarsal plate, which is the superior tarsal plate. Now these tarsal plates house these tarsal glands which open towards the margins of the eyelid. Now on the external surface of the tarsal plates is this Orbicularis Oculi muscle, which is circularly oriented, but when we've taken a section, we are going to see these fascicles of Orbicularis Oculi muscle, and these are the eyelashes on the margins of the eyelid. Now on the inside, this eyelid is lined by the conjunctiva of the conjunctival sac. So this part of the conjunctiva is the palpable part of the conjunctiva, and at the fornix, that is at this part, it changes into the bulbar part of the conjunctiva. The levator palpebrae superioris, which arises from the inside of the orbit, from the roof of the orbit, moves along the roof of the orbit, and then the muscle divides into an aponeurosis, that is a flattened tendon, which then gets inserted into various parts. A part of it, that is the upper lamella of this muscle, gets inserted into the skin of the eyelid. It pierces the orbital septum, moves through the Orbicularis Oculi muscles, and gets inserted into the skin of the eyelid. The middle lamella gets inserted into the tarsal plate, at the apex of the tarsal plate, and the lower lamella gets inserted into the superior conjunctival fornix. So all the components, it's getting attached to all the components of the eyelid, and when it contracts, this is the direction of the contraction. So it's going to elevate the upper eyelid, and that's the one which moves more out of the two eyelids, and thus increase the space, dilate the palpable fissure, and help in the dilatation of the palpable fissure, or the space which is present between the two eyelids. Right? So that is the action. Now this muscle is supplied by the levator palpebrae superioris, is supplied by the superior division of the oculomotor nerve. So that's the thing to remember. Rest of the muscles of the face we are going to supply by the facial nerve branches, but this is getting supplied by the third cranial nerve, which is the oculomotor nerve, because it's coming from inside the orbit. But there is a part of it that is the superior tarsal part of the muscle. That is some of the muscle fibers which are getting inserted into this tarsal gland. Now these are smooth muscles. The rest of it is a skeletal muscle which is under under voluntary control. You can voluntarily increase the size of your palpable fissure, but this part, which is getting the smooth part, which is the superior tarsal muscle, is under the innervation of the sympathetic nerves. And if you remember, in Horner syndrome, it was this part of the levator palpebrae superioris which was getting paralyzed when there was a lesion taking place at due to the cervical rib was compressing, or the apical cancer of the lung was pressing on to the stellate ganglia, which was present near the neck of the first rib. This was resulting in this condition, that is the ptosis, the drooping of the eyelid, which takes place due to paralysis of this particular component of the levator palpebrae superioris. We'll be talking about Horner syndrome in detail later, but this is what you need to correlate it with what we studied earlier. Okay, so the function of the levator palpebrae superioris is the elevation of the eyelid, the upper eyelid, which is important for the function of gaze. Now, the rest of the muscles of the forehead and the nasal cavity, I'm not going to do them in too much of detail. Please read them out from the book. But look at this muscle. The other important muscle is the corrugator superciliary, which is present in the medial side of the eyebrow, from the medial side of the eyebrow. And it also brings about the expression when it contracts is that of frowning, and it drags the eyebrows medially. It drags the eyebrows medially for frowning, but it is actually, what is it doing? It is shielding the eye and with the eyebrows from light and dust when we want to do that. That's what it is. The frontal belly of occipitofrontalis we've already seen. All these muscles will be supplied by the facial nerve, unlike the LPS which we talked about. All right. Then around the nasal cavity, the nostrils, their opening is regulated by this muscle which is known as nasalis. Now this again has a compressor part which is going to be constricting the nostrils, and it has this part, the alar part, which is going to be dilating it. All right. Again, as I said earlier, we don't use it so much like the animals, but we can show in the expression. These days, we do flare up our nostrils when we are angry, and this expression does come about. So that's the expression which comes about it. But the main function is that it brings about the opening and closing of the it helps in closing it helps in widening the nostrils and helping in more air to come in during deep inspiration, and the expression which we show is of anger. Now, next are the muscles which are present around the lips. The opening which we are going to be talking about here is the oral fissure. So, ye wali space. This is what we are talking about. Now, again, you can see it consists of number of muscles. I'm not going to do them in detail. Again, you have to read about them. The sphincter part of it is the orbicularis oris. Sphincter hai, to matlab goal all around the lips jana chahiye. So, it is going to be forming the bulk of the upper lip as well as the lower lip. This part is the sphincter part of it. This is the orbicularis oris muscle. Now it goes all around. It is present circumferentially around, forms the major part of the lips. Now near the angle of the lips, there is a thing out here which is known as the modulus. This modulus is a fibromuscular structure which is formed by all these muscles converging out here. It is 1 centimeter from the angle of the mouth. This structure is the modulus, which you have to understand. Now, the action of the orbicularis oris is that puckers you pucker your lips with the help of this muscle, or close the mouth. So, the act of whistling, during the act of whistling, the expression when you the position of the lips which it is, that is called puckering, and this is done by the help of this orbicularis oris muscle. Now the dilators, again longitudinally placed, and they are going around like the spokes of a wheel. All around they are exiting out. Now there are a number of muscles. The most superficially placed and in the subcutaneous is the Rhizorus muscle. Then deeper, अब इसी में planes है, in the superficial fascia. So सबसे ऊपर होगी Rhizorus, which is going from the parotid fascia towards the angle of the mouth. This is the muscle of grinning. Then comes the zygomaticus major and minor, which are the superficial layer, which are again going towards either towards the upper lip or towards the angle of the lips. Okay, so they are going to be dilating, moving the upper lip, elevating the upper lip. Right, and then these are these depressor anguli oris, depressor anguli inferioris, the levator anguli oris, which are forming the next layer. And the deepest one, which we are going to talk about, that is within the superficial fascia, superficial muscles, this deep muscle here is the buccinator. We're going to talk about this, and there is this muscle which is present out here, mentalis. So these are the dilator muscles which are making the oral fissure, which are dilating the oral fissure and making it large. These are supplied by the buccal and the marginal branches of the facial nerve. Okay. So again, in this picture, you can see how these muscles are radiating like the spokes. So your table teachers have already spoken to you or will be speaking to you about these various muscles in detail, but we are not going to do them in detail in this particular lecture. So let's go on to the buccinator. Now the buccinator is the deepest muscle which is present, which I'm saying it is the deepest because ये बाकी सारी muscles थी वो bone से superficial skin में जा रही थी. Now this muscle goes from bone to bone. There may be part of it which is going from towards the superficial fascias or the other areas, but mainly it is the deepest muscle वो bone से bone में जा रही है, and it is aiding in mastication. It's not a muscle of mastication, but it aids in mastication. How? Let's talk about it. So let's form the area around the oral cavity. So this would be the maxilla, which is forming the upper jaw. Okay, the cancellous part uska, and this would be the tooth. And here, let's draw the mandible, a cut section of the mandible. the teeth. All right. Now, here would be the rest of the oral cavity. Okay, so यहाँ पर we would have the let me draw. This would be the area of the, here would be the tongue which is present. So we've taken a coronal section. Now moving from the molar region, the area where the molars are present in the maxilla, bone of the maxilla, that part of the bone, from there to the oblique line of the mandible, again where near the oblique line of the mandible, again in the areas where the molars are present in the lower jaw, is this muscle which is known as the buccinator. So it is the muscle of the cheek. Right? So abhi tak hum muscles of the lips dekh rahe the. So this muscle is the buccinator, which is a muscle of the cheek. It is a quadrilateral shaped muscle which attaches to the maxilla above and the mandible below. And where does it attach? Towards the area or where the molar teeth are going to be there for both the muscles. Now this muscle here is the buccinator, and here we've taken, and this is a coronal section of the same which we are seeing. Now, anteriorly, this muscle has some of its fibers which are getting continuous with the fibers of the orbicularis oris, and posteriorly, it's getting attached to this connective tissue which is going from the, this is the medial pterygoid plates. Now, the problem with the head and neck is that a lot of structures come in which we don't know. So it's like a mystery movie. So many characters will be popping in and we have no clue about who they are. It gets confusing, but by the end of it, it all makes sense. So you have to persist with it and you have to keep on reading. So here there is this part of the sphenoid bone which we are going to be talking about. This is the medial pterygoid plate. और उसके पास ये एक hamulus है, pterygoid hamulus. From here going towards the mandible, okay, behind the third molar tooth, is going to be the pterygomandibular raphe. Now this buccinator, apart from the area of the mandible near the molar tooth, it also gets attached to the pterygomandibular raphe and it gets continuous with the muscles of the pharynx. Unfortunately, ये सब आपके book में भी दिया होगा. So I can't just skip this part. So what you have to understand that this muscle, which is quadrilateral shape, which is buccinator, पीछे की तरफ muscles of the pharynx के साथ continuous हो रही है. आगे की तरफ it is getting continuous with the orbicularis oris muscle. A part of its fibers go straight. Upper fibers are going upwards. Lower fibers are going lower. But the middle fibers, if you see, they have a different orientation. The lower middle fibers are going towards the upper lip. The upper middle fibers are going towards the lower lip. And this mode of its fibers is very important because it helps in its function. Now, what is its function? Let's do that. Now, this part of the oral cavity is known as the vestibule, which is present between the cheek and the teeth and gums. And this is the oral cavity proper. Now, when you chew food, right, you're chewing with the help of your molars. This food tends to go into this area, which is the vestibule. The action of the buccinator is such that it compresses this bolus, it moves, it contracts and it moves this bolus from the vestibule back into the oral cavity proper. After all, उसको वहां जाके oropharynx and thereafter esophagus में जाना है. वो यहाँ पर side में क्या कर रहा है बैठ के? So that is what is the action of the buccinator. So this is it is a muscle of the cheek and it aids in mastication. It is not a muscle of mastication. It is aiding in mastication by moving the bolus, it preventing the bolus from staying in the area of the vestibule but going back into the oral cavity proper. जब अब ये कर रहे हैं तो साथ साथ let's do the structures which are forming the cheek because we will need it when we are doing the parotid gland. Now on the inside will be present the lining this buccinator will be the mucosa of the cheek. That is the buccal mucosa. This would be the buccal mucosa. और जो यहाँ पर submucosa है उसमें थोड़े से glands पड़ेंगे. This is the buccinator muscle. Over it is lying the buccal pad of fat. So can you see? Over the buccinator is this pad of fat, which is the buccal pad of fat. And this is very well developed in children where the cheeks are all chubby. So this is the buccal pad of fat. Now, between the buccal pad of fat and the buccinator is present. One is present the deep fascia, which is present only in certain areas of the face. And this is known as the buccopharyngeal fascia. And thereafter outside, here would be the skin. So this is the structure of the chin. So it would be the skin. So we have the buccal pad of fat, skin, buccal pad of fat. Thereafter is the buccopharyngeal fascia. Then is the buccinator muscle. And then here would be the buccal mucosa, and in between the buccinator and the buccal mucosa, again there will be some glands which are present. Here abhi hame parotid mein chahiye hoga, so we can, because you can see out here there is this parotid duct which is piercing the buccinator to enter into the vestibule. Kahan khulta hai? Aapne padha hua hoga in your junior classes, right? So wo idhar vestibule mein khul raha hai, opposite some molar tooth, right? Second molar tooth. So that upper second molar tooth. So that is what is going to pierce all these structures and enter out here. So that's why we need to know the structures which are forming the cheek out here. So this is the buccinator. This buccinator is going to be supplied again by the, it is supplied by the buccal nerve. So like we discussed in scalp, the area has to be supplied, the area or the part which we are discussing has to have sensory innervation as well as it has to have motor innervation. So we have to discuss the sensory nerve supply as well as motor nerve supply. The motor innervation is going to be supplying the muscles. So the muscles of the face, the muscles of the scalp, and the rudimentary muscles which are present of the auricle. We can't move our auricle except some people. We are unable to move our auricle like the elephants do or the other. All these muscles are supplied by the facial nerve. Now, the facial nerve is unlike the nerves which we've done till so far. We've been talking about the spinal nerves. The spinal nerves originated from the spinal cord by a sensory root and a motor root. The facial nerve arises from the brain stem, right? So it's a cranial nerve. It's arising from the brain stem, number one. It also has a sensory and a motor root which join together to form a nerve trunk. Then it has a circuitous root which takes place in the cranial cavity and in the ear. After the circuitous root in the cranial cavity and the ear, it exits out the cranial cavity through a foramen in it. So अगर आपने अब तक skull देखा है तो आपको various foraminas के बारे में आपके table teachers बता रहे होंगे. So these foraminas are points of entry into the cranial cavity or exit out of the cranial cavity. So one such foramina is the stylomastoid foramen. Stylomastoid foramen. Now, this foramen is present between the mastoid process, the process which you can feel behind your ear. So, this is the external. This is your external acoustic meatus. Here would be the auricle. Behind this auricle is the mastoid process. So, it is present medial to the mastoid process and lateral to this process which is coming out from the a thin slender process which is coming which is there in the skull, which is known as the styloid process. So in between them is a foramen, which is the stylomastoid foramen, and exiting through that foramen is the facial nerve. The moment it exits out, it first gives rise to the posterior auricular nerve. Remember, we saw this nerve in the scalp, which was supplying the area of the scalp, which was posterior to the, which was running posterior to the auricle. It was not supplying the area of the scalp. It was the motor nerve. It was going posterior to the auricle all the way to supply the, it was going to be supplying the occipital belly of the occipitofrontalis muscle. Then it gives rise to another branch, which is going to be supplying a muscle called the digastric, which is arising from the mastoid process. And thereafter, the remaining nerve enters into the parotid gland, which is lying in front of the auricle. So, अगर अभी broadly करने के लिए हम उसको बोल रहे हैं कि it is in front of the auricle. हम exact position बाद में देखेंगे. So यहाँ पर auricle है. This is the external acoustic meatus. This area. ठीक है? Behind here you can see the posterior auricular nerve which is going. So this is the facial nerve. The moment it exits out, यहाँ पर parotid पड़ा हुआ है. It enters into the parotid gland. And within the substance of the parotid gland, it divides into two divisions. One is the temporofacial and the other is the cervicofacial divisions. The temporofacial division and the cervicofacial division. These divisions further divide into these branches, which at times join together, again rejoin and then further divide, ultimately giving rise to these 5 terminal branches which are going to be supplying the muscles of the superficial muscles of the face as well as the neck. These are the temporal, the zygomatic, buccal, upper buccal, lower buccal, mandibular and the cervical. So now let's do it in detail so that we are also able to understand the case which we saw earlier. So let's draw what we just saw. So this would be the mastoid process. Let's draw the mastoid process. The external acoustic meatus, which is just acting as a landmark. Or agar external acoustic meatus ke aage, you will be feeling the tragus. And then if you feel, you can feel a bone which is going all the way up to the cheek. This is the zygomatic arch. So we have the mastoid, the external acoustic meatus, as well as the zygomatic arch. Now our nerve, let's draw the nerve. It exits through the stylomastoid foramen, just medial to the. So a nerve is always a completely rod-like structure. So it exists, you don't make a lumen in it, like we make in the artery and the vein. So we make it a complete structure. It gives rise to the posterior auricular nerve, which goes behind the auricle. And it gives rise to a nerve which is going to supply the digastric. So this is the posterior auricular nerve, which supplies the occipital bellies, the occipital frontalis muscle. This supplies the posterior belly of digastric muscle. Thereafter, the nerve enters into the parotid gland. So let's make the parotid gland out here. I'm just drawing the position. This would how the parotid gland would be. This would be its apex below, right? Now the nerve enters the medial surface of the parotid gland, and within the parotid gland, it divides into a temporofacial and a cervicofacial division. So we have the two divisions which are here. These are, please label them clearly. This one would be the temporofacial division and this is the cervicofacial division. The temporofacial division gives rise to its first branch, which goes across the zygomatic arch. This is the temporal nerve, which we saw earlier, which supplies the frontalis, the corrugator superciliary muscle, all the muscles which are there on the forehead. So it goes into the area of the forehead. Okay? And the upper part of the Orbicularis Oculi. If this nerve gets injured or if this division of the nerve gets injured, there will be no wrinkling of the skin on the forehead. So यहाँ पर injury लिख देना ऊपर, ठीक है? मेरे पास इतनी जगह नहीं है, मैं नहीं लिख पा रही. आप no wrinkling on the skin of the forehead. And Orbicularis Oculi, if it gets injured, blinking will get affected. Right? Then the next branch of the temporofacial division is the zygomatic branch, which runs along the zygomatic arch. So I'm giving you certain small pointers because when we look at the specimen, we will have to identify each one of these particular structures. So another thing I want you to notice out here. Look at the temporal branch, how it's going. It's crossing the zygomatic arch. This zygomatic nerve is running along the zygomatic arch. So it gives, this is the zygomatic nerve. And what is it going to supply? It's going to supply the Orbicularis Oculi. The lower part of the ocular and major part, lower as well as the sides, say, the Orbicularis Oculi. Injury to the zygomatic nerve as well as the temporal nerve will paralyze the Orbicularis Oculi. There will be problems in blinking. That is, the person will not be able to blink, no blinking. There will be corneal dryness because the major function of this was to move the tear film medially. So there will be corneal dryness, and at the same time there would be the tears would start falling from the lateral side of the eye. So some of the symptoms and the signs which we saw in that gentleman in the beginning of the class are now going to start making sense to you. Then comes the cervicofacial division. Now, it first gives rise to, two branches first. Oops. The upper buccal and the lower buccal. The term upper buccal and the lower buccal is that one is present above the duct of the parotid gland and one is present below. There may be variations, but that's what it is. So this is the duct of the parotid gland, and running over it, one which is running over it and one is which is superior to it and one which is running inferior to it are the upper buccal and lower buccal. Now, seeing its placement, you can understand that this is going to supply the muscles of the nose as well as the dilators of the upper lip. Muscles of the upper lip. Okay, so this will be coming in with the upper buccal. The lower buccal would be supplying the Buccinator as well as the Orbicularis oris. Lower buccal will supply the Buccinator, which is in that area, and the Orbicularis oris. So paralysis of this muscle, Buccinator, will cause collection of food in the vestibule, difficulty in chewing, which was one of the complaints which our gentleman gave, as well as orbicularis. So, क्योंकि food collect हो रहा है and the food was falling off from the right side. So that is what would be the problem. And because of the paralysis of orbicularis oris, there may be distortion which is taking place around the lips, again, which we saw in the gentleman. Then comes the next muscle, nerve, sorry, which is the marginal mandibular nerve. Now with this nerve, I will do certain things which are very important because अब आप लोग हमारे साथ तो हो नहीं तो हम नहीं अभी आपको दिखा सकते, but I will tell you so that when you come here and you're able to see this. Now this nerve is the marginal mandibular nerve, which is a branch of the facial nerve. So the facial nerve is dividing into these 5 branches, and because वो I told you कि कभी वो जुड़ रहे हैं फिर वो they are uniting then dividing, ultimately these 5 branches are formed, and as a result it is like a goose foot, they also call it that this arrangement is like a goose foot. This marginal mandibular nerve crosses 2 structures at the area which is the junction of the ramus of the mandible and the body of the mandible. So you know where the mandible is in your face. Now trace the mandible. The part, let's start from the chin. This part which is present horizontally, this is known as the ramus of the mandible, is known as the body of the mandible. This horizontal part is the body, and the one which is going vertically upwards is the ramus. Now at the junction of the ramus and the body of the mandible, in front of the angle of the mandible, ये जो point आपको अपनी mandible में दिख रहा है, उससे आगे, at the junction of the ramus and the body of the mandible, this marginal mandibular nerve crosses over 2 structures. These are, number 1, the facial vein, We'll be seeing that in the next class. And the facial artery, which is on its way to the face. One is which is exiting. So from outwards, inwards, if I were to go, I would come first across the marginal mandibular nerve. Then would be the facial vein, and then would be the facial artery. Now, where is this arrangement present? This entire configuration is at the junction This is present at the junction of the ramus and body of the mandible. हम mandible में आपसे पूछते हैं कि यहाँ पर क्या है. Why is this important? Because if an incision is made at this point in the mandible, this would result in injury to this marginal mandibular nerve, which is very superficial. And an injury to this nerve would result in paralysis of the depressors and the muscles of the lower lip. Paralysis of the muscles of the lower lip would result in deviation of the mouth, which we saw in our gentleman. Now, what happened in that gentleman? उसको तो यहाँ पर किसी ने incisions नहीं दिए थे. उसने तो बोला मुझे fever था और fever के बाद मुझे ये सब होने लगा on the face. So this is a condition which is known as Bell's palsy. I'm sorry. This is known as Bell's palsy. Now, the Bell's palsy is damage to the facial nerve, which takes place anywhere along its course, especially in the area of the ear, in the parotid. It can also take place due to infections. It is usually idiopathic. We do not know when the injury takes place in its course in the ear. It results in a condition known as Bell's palsy. We will be discussing this again, but we may not discuss these muscle aspects of it. So you should know this in detail. We will not touch them in detail, so much detail again, but you should know about this. So Bell's palsy is idiopathic. We don't know the cause. It could be due to infection. Fever is usually, its presentation is like what we discussed. There is fever, and thereafter there is this distortion which takes place. When this takes place within the ear, within the middle ear, as well as in the part of the course of the facial nerve, it is known as Bell's palsy when the cause is not known. And this results in, number one, what are the problems which the patient comes in? It is usually appears and suddenly and peaks in 48 hours. It is marked by sudden distortion of the face. It may sometimes be accompanied by other things like loss of taste and loss of secretion of the lacrimal gland. But usually, the patient presents with these findings, which are gentlemental. Corneal dryness and ulceration, tearing of the eye, which takes place, that is, tears naturally gir rahe hote hain. There is no wrinkling in the skin of the forehead. There is collection of food in the vestibule because the Buccinator and the Orbicularis oris is paralyzed on this side. The best test is to ask the patient to try and blow his mouth, because that is an action of Buccinator, which we forgot to discuss it in Buccinator. So one, I said it aids in mastication. Another action of Buccinator is that when you blow your mouth, like जैसे वो trumpets बजाने के लिए करे या जब आप अपने वो फुला के रखते हो अपने cheeks, so that action is possible due to Buccinator. And if the Buccinator is paralyzed, he will not be able to hold air in his mouth. And that is the best test for seeing whether the facial nerve is intact or whether the facial nerve is damaged. That function is lost in Buccinator. So I'm last in facial palsy because of the paralysis of Buccinator, and the patient complains of dribbling of saliva because the oral fissure is not completely closed. The food remains in the vestibule, so he's unable to chew properly, and that are the complaints with which the patient comes in. The speech is slurred, and the lips deviate towards the normal side because one side muscles are working. They tend to pull the lips towards that side. Where the side where they are not working, it's absolutely like वो कुछ भी expression नहीं है. Whereas दूसरी side काफी animated है, जैसे हमने अपने patient में देखा. The lips are pulled towards the normal side. Please remember that. And the last branch, which I forgot to show in the last diagram. Please make it in that particular diagram only, which comes out from the cervicofacial division is the cervical branch, which exits at the apex of the parotid gland, enters into the area of the anterior triangle to supply the platysma. Please draw this branch in the previous diagram. This cervical branch supplies the platysma, which is a muscle which is present in the superficial fascia of the face, partly near the mandible, but mainly in the superficial fascia of the neck. So we will be discussing this later. Please make this in the same diagram. This cervical branch, which is coming from the cervicofacial division and exits out from the marginal mandibular and exits out from this particular exits out below the marginal mandibular nerve and exits through the parotid through the apex of the parotid gland. So another easy way to remember the disposition of the branches of the facial nerve is to place your palm of the palm of your hand like this onto your face, and then you can easily remember the disposition. This would be, your little finger would be the temporal nerve. The one which is going along the zygomatic arch, the ring finger would be the zygomatic nerve. The buccal would be the middle finger. The marginal mandibular near the mandible would be the marginal mandibular, and the cervical, which would go into the neck. So this picture out here again tells you what are the, if this nerve gets damaged, what are the complaints or which you would see in the patient. That is absence of forehead wrinkling, dry eye or excessive tearing, facial paralysis and weakness of the muscles of the face, drooping corner of the mouth, dry mouth, and sometimes even impaired taste, because the facial nerve, though we've discussed only the motor aspect of it, is also involved in the taste sensation, which we will see as we go on further. Now, before we end this lecture, let's also talk about the sensory supply of the face. Now, to understand the sensory supply, you need to understand two things, and you will have to take my word for it because, again, you don't know the details yet. The face is made up of three swellings. Developmentally, three swellings form it. One is this frontonasal process, and as the name tells you, it forms a large part of the forehead as well as the nose. Then there are these two maxillary processes and the mandibular process. Now, you can see this is the area of the oral cavity. This would be the place where ultimately the oral cavity would be formed. So, various parts of the face would be formed by these three processes. The frontonasal process, which would give rise to the forehead and a part of the nose. The maxillary process, which will give again rise to the part of the nose as well as the upper lip, and the mandibular process, which would give rise to the lips. And I'm talking only about the superficial structure. Now, each of these processes has its own nerve with it. And these nerves are divisions of the trigeminal nerve. So the sensory supply of the face comes from the trigeminal nerve, which is the fifth cranial nerve. Again, it arises from somewhere from the brainstem. It arises from the brainstem. Presently, I'm using the term somewhere. But as we go on to neuroanatomy, you will have to know the details of it also. We can't just say somewhere and get away with it because ma'am ne kaha. Ma'am is saying somewhere because we haven't studied neuroanatomy yet. So it arises from the certain parts of the brainstem. From there, it moves within the cranial cavity. It forms this ganglia, which is a large ganglia, which is the trigeminal ganglia, which ultimately divides into these three branches. The green one, which you can see on your screens, is the ophthalmic nerve. The orange one is the middle division, which is the maxillary nerve, and the blue one is the mandibular nerve. And we've been talking about them even when we talked about the innervation of the scalp. So, sensory nerve supply, again, of the scalp and the face are the territory of the trigeminal nerve. And it supplies through its three divisions, the ophthalmic, maxillary, and the mandibular nerve. The ophthalmic mostly supplies all the derivatives of the frontonasal process. The maxillary supplies the derivatives of the maxillary process, and the mandibular supplies the sensory innervation to the derivatives of the mandibular process. Now, further, before I go on to help making that diagram, we have to also understand one more thing. Now, this ophthalmic nerve. Now, let's focus on the ophthalmic nerve. The ophthalmic nerve, from wherever is this trigeminal ganglia in the cranial cavity, that is, it's present in a trigeminal fossa, which is at the apex of the vitreous part of the temporal bone. Again, too much of information, not needed right now, but we have to study. We have to know about it. It divides into this ophthalmic nerve. it gives rise to the ophthalmic nerve, which enters, which divides into its various branches, which are there, which enter in the orbit through the superior and the through the superior orbital fissure, and ultimately these branches further divide into their terminal branches, and these terminal branches exit out through the various foraminas which we saw on the face, the norma frontalis part of the skeleton. So first of these is the lacrimal nerve. This lacrimal nerve comes out on the lateral side. So एक छोटी सी branch है lacrimal nerve on the lateral side of the आपके lateral margin of the orbit के पास निकलता है. Then is this supraorbital nerve, which comes out through the supraorbital notch, and on the near the roof there is a projection again, which is known as trochlea, not very well felt. उसके ऊपर से एक nerve आ रही है, which is the supratrochlear nerve, and उसके नीचे से एक nerve आ रही है, which को हम बोल रहे हैं infratrochlear nerve. And there is another nerve, which is the external nasal nerve. So by means of these 5 nerves, which is the lacrimal nerve, the supratrochlear, the supraorbital, the infratrochlear and the external nasal nerve, the ophthalmic nerve. These are the terminal divisions of the ophthalmic nerve. The ophthalmic nerve is going to be supplying the various components of the face. You've already seen the supratrochlear and the supraorbital nerves in the area of the scalp. So we'll again make them and understand कि वो कहाँ placed है, कौन से structures का skin. That is going to be supplying the skin. They will be supplying some of the paranasal sinuses, the mucosa of the oral cavity, the gums, the teeth. All this will come under the innervation of the trigeminal nerve. Then look at this orange part. This was the maxillary nerve. Again, after a course which it takes within the cranial cavity, outside the cranial cavity, ultimately it enters into the orbit. And once it's in the orbit, it exits out through this infraorbital. Its terminal division exits out through the infraorbital nerve. So the maxillary nerve continues out as the infraorbital nerve after it's given its various branches. And this you saw exiting out through the infraorbital foramen, which is present in the norma frontalis view of the skull. Then there are these two which come again out from the similar named foramens, that is the zygomatico-facial nerve and the zygomatico-temporal nerve. This zygomatic-temporal nerve again we saw in the scalps, innervating the scalp. So again यहाँ से maxillary की division है, वो इधर इसके पीछे से, इस part के पीछे से आके एक foramen है zygomatico-temporal nerve, the foramen उसमें से exit करके scalp को supply कर रही है. And it's also going to be supplying this area of the face which is out here. So the maxillary through its divisions infraorbital, zygomatico-facial and zygomatico-temporal supplies the face. The mandibular nerve. Now it also has various branches. One of its branch, that is the auriculotemporal nerve, we know that it's behind the it is present in front of the auricle, in front of the auricle, where it's running along with the superficial temporal vessels, and it's going to be supplying the area of the scalp in front of the vertex, which from the imaginary line from the auricle se vertex mein draw kari thi. So that is the area which was of the scalp which was being supplied by the auriculotemporal nerve, and it's also going to supply the area of the temple. Now by temple, what do I mean? The sides. ये जो side of the face है, जहाँ पर first graying शुरू होती है यहाँ पर. So this area is also known as the temple of the face. So this is the area where the auriculotemporal nerve, which is a branch of the mandibular, will be supplying. The front of in the anterior part of the face, we would have the buccal, which would be supplying a part of the face, as well as the a nerve which is coming out through the mental foramen, which is a branch of the mandibular nerve, which is the mental nerve. So together, all these nerves are going to be supplying the face. But to make it easy, we divide the face into 3 zones. And what you have to remember, ये तीनों zone, ophthalmic zone, maxillary zone and mandibular zone, you just draw. ये 3 zones के अंदर ये वाली divisions है, ये वाली branches है, which are ultimately supplying the face. And ophthalmic zone is ultimately the derivatives of the frontonasal process. The maxillary zone is basically the derivatives of the maxillary process, and the mandibular zone is basically the derivative of the mandibular process. So now let's see the sensory nerve supply of the head and neck by mapping out the zones, the ophthalmic, the maxillary and the mandibular zone. And let's map it out in a lateral view. So let's start by drawing the face. The nose, up lip, See, it doesn't have to be beautiful, it has to be correct. Lower lip, chin, neck. Now here would be the area of the angle of the mandible. Okay, let me draw it in a dotted line so that we know. This would be the, okay, would be somewhere here. I would be having, this would be the area of the angle of the mandible. Okay, this I need specifically, so I'm making it at the angle of the mandible. Then let's go on to the forehead, the scalp, remaining part of the neck. Here would be the auricle, the area of the external acoustic meatus. Now also, before we, because since we are talking about the trigeminal nerve, let's make that vertical line from the auricle to the highest point of the skull, which is the vertex. This is the line, the imaginary line which we were talking about. Now let's start mapping up the zones. No, let's make the eye first. This would be the eye, the side view, upper eyelid. This would be the iris, and here would be the eyebrow. So now all our important areas, the relevant areas which we need are in place. Now let's start mapping out the zones. Now start with the ophthalmic zone. The tip of the nose, the side of the nose, the upper eyelid, major part of the forehead, all this area is the ophthalmic zone, all the way up to the vertex. This area is the ophthalmic zone. Ophthalmic zone. Okay, so area which is behind this imaginary line of the from the auricle to the vertex, this is under the cervical plexus, and the area of the neck is also under the cervical plexus. It's the area of the face which we are mapping out, which is with the trigeminal nerve, and the first zone which we mapped out is the ophthalmic zone. The upper lip, the lower eyelid, the ala of the nose, the side, the ala of the nose, the upper lip, majority of the cheek, and a small part of the temple. This is the maxillary zone. The lower lip, the chin, part of the mandible, excluding the area of the angle of the mandible. Oops. Part of the mandible, excluding the area of the angle of the mandible, the cranial part of the lateral surface of the auricle, the external acoustic meatus, and the leftover temple. All this is with the mandibular zone. Now, one thing to remember is that the area of the angle of the mandible is under the innervation of the great auricular nerve. This area, which is a cervical branch of the cervical plexus. This is with the great auricular nerve. ऐसा क्यों है? Now, if you see these zones, the three zones which we've marked, they're not horizontal. They're in an oblique fashion, and all of them are as if they're being pulled up towards the vertex. So as the brain and the skull grows, the skin of the face gets pulled up obliquely. It gets pulled up towards the area of the vertex. And when it's getting pulled up, जैसे आप अपना कंबल को चद्दर को अपने ऊपर खींचते हो, वैसे वो ऊपर की तरफ pull हो रही है, and when it's getting pulled up, this area comes under the innervation of the cervical plexus because rest of the skin is getting pulled up. So that's where the great auricular nerve comes. Now, one thing you've understood, why is there an oblique distribution and what are the three zones? Now let's put in the nerves which we've already discussed, the terminal parts of the nerves. So the lateral part of the eyelid and the lateral part of the eye, this is getting its nerve supply from the lacrimal nerve. So let's put in the lacrimal nerve. Please label them. You label them nicely by making these arrows and taking it outside. Okay, don't label it the way I'm labeling it. I don't have that much of space. Then the middle of the eyelid, the middle of the conjunctiva, the middle part of the forehead, all the way up till the vertex. This would be the supraorbital nerve. More medially, the glabella and all the part up till the forehead as well as the scalp until the hairline would be under the innervation of the supratrochlear nerve. The upper part of the bridge of the nose and the medial part of the eyelid also is supplied by the infratrochlear nerve. All these are branches of the ophthalmic division, the terminal branches of the ophthalmic division, and the remaining part of the bridge of the nose and the tip is under the innervation of the external nasal nerve. Okay, this is how the divisions of the ophthalmic nerve are supplying the ophthalmic zone. When we come to the maxillary nerve zone, from the infraorbital foramen exits the infraorbital nerve, which supplies the lower eyelid, the part of the side of the nose, the mucosa as well as the upper lip ke oral cavity ke upper lip ka sara corresponding area, maxillary sinus, the oral mucosa of the upper lip, as well as the cheek, part of the cheek, which is supplied by the infraorbital nerve. Then we have the two named nerves which were coming out of the foramens. A part of the cheek, zygomatico-facial, which came out of the similar named foramen, and the zygomatico-temporal, which also supplied the scalp. You saw it in the scalp as well. The zygomatico-temporal. So this is the maxillary. With regards to the mandibular zone, in front of the auricle, supplying the auricle, the external acoustic meatus, outer surface of the tympanic membrane, the skin of the scalp, above the auricle, in front of the auricle, and the hairy skin of the temple. All this was supplied by the auriculotemporal nerve, which was accompanying the superficial temporal vessels. Auriculotemporal nerve. Then the cheek is by the buccal nerve. ऐसे label करना है, हाँ? Buccal nerve. Auriculotemporal nerve. And the skin of the lower lip as well is supplied by the mental nerve. The great auricular nerve, as we discussed earlier, is a branch from the cervical plexus. Okay, so this is how we map the face into its three zones. Now, because there are clear-cut, well-defined zones that ये ophthalmic division के पास है, ये maxillary division के पास है, ये mandibular division के पास है. Plus, ये वाली nerves, ये वाला part supply करिए. Local anesthesia is utilized in a big way in doing various interventions which are done on the face as well as in the oral cavity. So these the nerve blocks which can be used are the infraorbital blocks, the mental block, the buccal nerve blocks, and these are widely used in dentistry. Then again, another disorder which is seen because of this trigeminal nerve is the trigeminal neuralgia. Now, what is trigeminal neuralgia? The trigeminal neuralgia is a neurologic condition in which the trigeminal ganglia, something happens in which usually they say is the compression of the trigeminal ganglia by some blood vessel, but it's still not known clearly what happens, as a result of which there is an excruciating pain, burning pain in one of the divisions which is of the trigeminal nerve. Usually the maxillary zone is involved. So the person will complain while they are brushing their teeth or just when a whiff of cold air comes in, there is this extreme pain which comes in, or they're just chewing food. There is this extreme sudden acute pain which takes place in the distribution. They will not tell you the distribution. They will say यहाँ पर cheek में होता है, which you have to map out is the distribution of the ophthalmic division or the maxillary or the mandibular division. And this intense facial pain is seen, this intense facial pain which happens in the distribution of the trigeminal nerve is known as trigeminal neuralgia. As I told you, the cause for it is uncertain, possibly the vascular compression which is taking place. Now, another condition which happens in the zones and we have to know the zones for it, is the herpes zoster or shingles. This is the most common infection, like we saw the herpes zoster in the thoracic area. Here, the virus remains latent in the trigeminal ganglia. When the immunity is lowered, it now comes into one of these nerves. So in ophthalmic zone, maybe in this particular patient, you can see that the shingles are present, or the shingles or the pustules which are developed, the vesicular rash which is developed, is present in the area of the ophthalmic zone. And if it's here, you will know that it's the maxillary zone. Or agar idhar ho raha hai, to you will know it is the mandibular zone. So you need to be clear in your head that which is which zone of the trigeminal nerve, because it is very important. It helps us to understand a number of diseases, a number of disorders which you will be seeing when you go on to into the clinics. And the last thing, you may be asked to test the facial nerve. You may be wanting to test the various zones, whether ophthalmic division involved hai, maxillary hai, whether mandibular hai, due to whatever. So you will be touching that particular area or asking that patient whether he feels any sensation in those areas or not. So I think with this, so we come to the end of this lecture. So this is a frequently asked diagram question, which I've taken from Snell's Clinical Anatomy. This tells you, we've discussed this part of it, which is showing the sensory supply of the area of the head or the face. We've also done the scalp part of it. The remaining part of the neck we will do as we go on further. So you should be able to draw this diagram. And it's an important question, but you have to be careful as to what is being asked in this particular question. So thank you, and I'll meet you again. I'll see you again with the next class, which is part 2 of this particular lecture.